Okay, everyone, thanks for listening. We are super excited. Our new show, same conversation, same topics, new platform. This is now Sports Doc Talk, and when I tell you it's all sports, all orthopedics, all the time, that's exactly what you're getting. I'm Will Sanchez. I'm with our orthopedic surgeon and sports medicine specialist, Dr. Grant Garcia. Just a quick rundown. It's a podcast that's going to feature sports injuries. We're going to have sports updates, orthopedic sports treatments. You want cutting edge conversations? We have it. We'll discuss what's hot in sports and how sports orthopedics plays a big part of it, and especially keeping our athletes going. So we're going to give you a little this, a little that, but we're just going to have a great time. Let's get right to it. This is going to be our Super Bowl show. We're going to talk some injuries, have a little trivia, predictions. I'm pretty sure that's going to go wrong, but let's bring in Dr. Garcia. Dr. Garcia, welcome. And I know you're excited about our new platform. Let's just get right into it. Talk a little bit about Sports Doc Talk.
Well, thanks again for introducing this. I am extremely excited. We've talked about this for a while and sort of heard what listeners said. And, I talked to some friends and family who had listened to the podcast and really found a way looking on the internet and kind of seeing what other people are doing and seeing that what people want. And I'm really excited to rebrand this. I think we're going to be able to do a lot more with this new podcast. We're going to have things such as live guests from around the world, top orthopedic surgeons, some of them professional team doctors, friends of mine. I'm really excited for you to hear some expertise from other surgeons other than myself. I'm really excited for you to hear some of the top physical therapy groups and for everyone to really learn like cutting edge on all levels, from the physical therapists to the surgeons to the implant companies. We're going to have hopefully some implant companies in addition to some of the sort of backbones of orthopedics and some of the executives for there as well. In addition to hopefully getting some viewer input, we're going to be remaking a full website, which is coming live soon. You can go to my website currently over the next 24 hours and be able to put requests in if you want on www.grantgarciamd.com for now. If we have a topic that we like or you send us a topic, we'd love to talk about that as well, because really this is fun for us. We want to make sure that people are informed. They're hearing about this cutting edge materials because I see so many patients that, they hear that we do cutting edge stuff, but they don't really understand what it is, or they don't really understand what's happening in the media. And we have a perfect example, which we'll talk about shortly, about sort of cutting edge surgeries and trying to explain them better for the standard patient population, because those are still available for you as well. You just need to understand what they are.
I was so excited. We were about to start the show. We got about 5 seconds in. I kicked the power cord. The whole thing shut down. So it just tells you the level of excitement that we are. Listen, it's Super Bowl time, right? It is Super Bowl 57. We got the Kansas City Chiefs versus the Philadelphia Eagles. It really kind of pains me as a Giant fan to see the Eagles there, but I don't want to get too caught up in all that stuff. I know you're a Giant fan as well, but we'll let the Eagles fly a little bit for at least, one more week, and hopefully the Chiefs will take them out. But let's start out, because I'm going to bust your chops, and we're going to get a little sports trivia going right now. So here comes your first one, right? How many Super Bowl games has Arizona hosted? This is where this year's Super Bowl game is being played. Can you tell me how many games has been hosted there? And if not, or can you name at least one game that was played there?
Oh, well, I would say I can't remember the exact Super Bowl. I know there's been at least one more in Arizona. I would like to say, let's say 4.
That is absolutely correct. And can you name at least one matchup?
Wasn't one of them the Giants and the Patriots?
2007, New England Patriots going for 18-0. Our New York Giants came in and beat them, and that's why I had this trivia question. I was like, if he doesn't know the number, he better know the team, because he's a Giant fan, and we want to make sure that we don't take away his card. So you are off and running. See, I think it's a new platform, man. This is exactly what it is. New platform, you're ready to rock and roll.
That's probably the very first time I got the trivia right, too, so I'm very excited.
All right. Before we get into the Super Bowl matchup and just a couple of key injuries, let's kind of go back to the NFC East Championship game. San Francisco 49ers coming in. Brock Purdy gets injured really early. Backup comes in, has a concussion. They pretty much play the entire game without a quarterback. We have some new information now that came out in the last few days about Brock Purdy. They say that he's going to have elbow repair versus Tommy John. So before we get into what that is, what do you mean? What is the comparison between an elbow repair and having Tommy John surgery?
So, a lot of it's minutia. And so we can kind of explain differences.
Okay.
One thing, though, obviously for the listeners, we'll go into this briefly today, but we've got previous episodes that we've loaded up on Sports Doc Talk. You can listen to some of the internal bracing talk and the talk about UCL injuries, too, to hear this in more detail. And we recently just posted on Sports Doc Talk about this, so you can read the ESPN article if you're interested as well. But basically, it's sort of trying to put it in layman's terms. He tore his Tommy John ligament, or what we call the ulnar collateral ligament of the elbow. It's the ligament on the inside. We call it Tommy John because Tommy John was the first player to get this surgery, and people tend to know what Tommy John injury is. But it's really called a UCL injury, or ulnar collateral ligament. There are sort of three main ways to take care of this. It used to be two, which was either you live with it and you don't play baseball again, or you get a reconstruction, which is the one that we all hear about, 12 to 18 months. You don't see that player for maybe a whole year and a half, and then all of a sudden they pop back on the scene. And then we have this sort of new innovative technique called UCL repair, and where we can actually repair this ligament with a significantly faster recovery, going from that sort of 12 to 18 months to 6 months. And this is what Brock Purdy elected to do. So, yes.
I bring it up, and Brock, I'm going to apologize right now. This has nothing to do with you, but I love talking about internal brace. So it's just one of those things I get really excited about. And anytime I can get, Dr. Garcia to talk about it, it's just right up my alley. You make fun of me for talking about it, but hopefully Brock Purdy is going to recover sooner than later. What is the timeline? Will Brock Purdy be ready to go to start the season?
So potentially, the impressive thing about this procedure, I did one of these a few weeks ago. I know this application of the internal brace, in addition to repairing the UCL, biomechanically is the same level of effectiveness as actually doing reconstruction. So, they're continuing to push the envelope. As you see now, professional players are getting it. When we were doing the White Sox, there were a few catchers, et cetera, but there aren't that many pitchers yet that have gotten this surgery just because that's sort of the last frontier, right, of this sort of procedure.
Yeah.
He also has a certain type of injury, right? If you have a complete tear somewhere in the mid-substance of the UCL or some other area that's harder to fix, you don't really want to do this surgery on somebody. So he probably got a number of opinions, and he had the tear that was amenable to fix, which all worked out in his favor. So the goal is for him to be ready. Obviously, every player is different. He is a thrower, but he's not throwing a baseball, which is a different mechanics than a football. So I would hope that he could be ready by then. Usually start throwing at 3 months, and back to sort of full throwing by 6 months. And again, pitchers tend to be a tiny bit longer, but a quarterback or, we call it javelin thrower, et cetera, those tend to be on the little faster side. And then a non sort of like a catcher or a sort of a non-usage of that arm for throwing are much faster with this procedure. So most of my patients elect for it if that given the option.
And is that because there's more of the shoulder involved instead of the whipping from the elbow compared to a pitcher?
Yes, that is one part of it. And two, it's just different mechanics for the football, right? You're not throwing, they're putting the UCL tears in the elbow happen, right? I think Ben Roethlisberger had it happen to him.
Yep.
And I think, I don't think I remember Tom Brady, but someone recent, or someone maybe not as recently had this injury. It doesn't happen as often in football players or players because the reason this happened to him is because he got hit, right? So the force was more. This is like an acute injury, like one of my patients might have that falls on the ground and hurts their UCL, rather than just from overuse of throwing. Baseball players get it because they're doing so much repetition and they're having to throw the ball at so much higher torque.
So if everything goes right, we're looking at him at being back for the start of the season. Obviously, if you're the 49ers, you probably have to have maybe a decent backup or someone ready to go for that start of the season, especially if he doesn't get a chance to get into training camp. But that's a conversation that we could get into in the off season when we have some other shows. So we'll move on at this point. We got the Eagles and we got the Chiefs. Nasty. To me, it sounds nasty, and I'll start with the Eagles' offensive tackle, Lane Johnson. They say it's funny. You look at the injury report, and it says groin rest. Will have surgery on his groin after the season, torn adductor, and I'm like, what? He's playing football. He's playing on the biggest stage. First off, what is a torn adductor?
So the adductor is a mix of multiple muscles that attach the pelvis. So whenever you talk to sort of orthopedic surgeons or you talk to sort of anybody that's with the specialty, this is another level of specialty, these sort of groin injuries, because we don't see them that often, right? I do mostly shoulder, elbow, and knee, and even people that do hip, this is a very uncommon thing, even to have someone that knows how to do this surgery particularly. So this is a very unusual injury to level of surgery. Groin injuries are very common. I had them myself as an athlete. That happens. So basically you have muscles on the outside of your legs and on the inside. The inside leg ones are the groin muscles. So remember LeBron had one of those a few years ago. It put him out for a while. Yep. And then you have levels of strain. So it's just sort of a layman's term for a groin pull because there's four different muscles there. But you can have, it's the same thing as other sprains. So you have grade 1, which is mild. Grade 2 is sort of the more aggressive, and grade 3 is where the entire tendon rips off. Or you can have a full muscle tear. Grade 3s are the ones that sometimes need surgery, so that's not ideal. And he probably had a grade 3 injury and maybe just tore one of the tendons off. But we're finding out, just like we found out with other parts of the body, that, avoiding surgery for high-level athletes is usually not a good idea, especially with these situations, because they need every muscle they can get to be so powerful and do what they're doing. And so that's why he has elected to probably have surgery on this groin muscle pull.
We've talked about it before on other shows that these guys, and women as well, these athletes, they're just built different. The mindset is different. We had an episode, and please check it out. It's called What It Takes. We talked about it, and I just cannot imagine, because having the conversation that we're having right now is uncomfortable enough, let alone a 300-pound man going against other large men and having this injury. Does the weight and the size and having constant contact every time you snap the ball, what does that do as far as a pain threshold or the ability possibly to really injure it further, or just because it's already torn, you're not going to be able to, you're not doing much but tolerate the pain?
So, we've talked about this, like you said, other shows. These players are abnormal. They're above our normal people that we meet. They put up with a lot of pain. And sometimes, unfortunately, it's negative for them in the long run. But they're able to tolerate higher levels. We'll talk about Mahomes in a high ankle sprain and playing through that. These athletes are able to do things that we, even when they're 80%, they're better than anybody we know. And yes, it does have 100%. It involves one, when we look at an athlete that comes in, I look at, status. So, how good are they from a level, varsity, professional, college, semi-professional, et cetera. And then, so size. And, for these guys, it depends on, it's a contract year. There's so many factors that come into this on what to do next. The answer with a torn adductor that's fully off in a high level athlete is surgery, especially in this situation. But there's so many more factors that go into this. We're just sort of getting a very small piece of it. And we've talked about this before, and we can have a whole separate show on this.
Oh, man. All right, here we go. Here's your next one. You ready? All right. Why does the NFL use Roman numerals?
Oh, my goodness. Maybe it's something to do with the heritage of the NFL.
That's a good one, and there is some heritage involved with this, right? And I asked this question because it ties in a little bit with the game. So they use Roman numerals to avoid confusion, right? So Lamar Hunt is the former owner of the Kansas City Chiefs, right? And this is how we tie it into the game. And he came up with the Roman numerals given that the actual championship game is actually played the year after the corresponding football season, right? So we're the 2022 football season, but the championship game is played in 2023. So to avoid confusion, he used Roman numerals. But if you're not really good with Roman numerals, you have no idea what the numbers mean. So just for everyone's knowledge, it's Super Bowl 57. So that was our little information for everyone there.
Cool.
So, all right, you mentioned Patrick Mahomes, and we'll jump over to the Chiefs side really quick. Patrick Mahomes, he's been playing with his high ankle sprain that he suffered in the playoffs, and if for anyone that watched the game, he did not want to come out of the game. He got really upset when Coach Andy Reid sent him to the locker. He had a tantrum because he's just so competitive and wanted to get it back out there, and he eventually did. Let's talk about high ankle sprains because Clyde Edwards-Helaire, he's the running back for the Chiefs. He's coming back from a high ankle sprain, and he's been out since week 11. So what are we looking at there? About 8 weeks, 9 weeks? So for Patrick Mahomes not to miss a game, and then you have a running back to miss 2 months, can you just explain high ankle sprain and how they're different, for these two players?
So, one thing taken into consideration is, like you said, Mahomes is insanely competitive. And I don't think that him coming back so quickly would have happened if it wasn't the level of play that's happening right now.
The playoffs.
Playoff level. Yeah. It's extremely unusual, at least in my experience, to see someone with a high ankle sprain that is able to play within a week or two. So I don't really know if there's anything else that we're not hearing about with regards to the injury, and maybe it's a little lesser. And again, so high ankle sprains in general, you have, two bones, the fibula and the tibia and the ankle.
Yep.
And you may know a lot of people that ankle sprains, and those are the lower ligaments of the ankle. And those people can come back in a week or two, and we know our two Giants players, Dan Jones and Saquon Barkley, both had them. But the high ankle sprain is where you injure the connection between the two bones that are all the way up or higher up. And when you injure that connection, that's a bigger deal. It takes a lot longer to recover, almost double the recovery of a standard ankle sprain. And sometimes it needs surgery. And the only thing that concerns me about Mahomes' injury is he going to need surgery as soon as he's done with the season? Because he sort of played on it, right? Is he already said, I'm going to get surgery. I'm just going to push through this. Hopefully I don't damage too much and then get a surgery. Tua got this surgery, I'm pretty sure. He's the one that flew out. He had the surgery on his ankle, and then 2 or 3 weeks later was able to play because what they did is they put these special bands or some sort of an internal brace, we call it a tightrope, through the ankle, and it's very minimally invasive, and you can fix these quite easily in certain athletes, and it's sort of no screws are there, which is really nice. There are other ways to do it, but that's sort of a more innovative technique.
And for someone like Clyde Edwards-Helaire, is it just pretty much the same injury, but the fact that he's playing a running back position where he has to stop, cut, and he's pretty much guaranteed to have contact on every play, that's where you have to kind of treat a little bit different. And I guess also the fact that it happened in Week 11 and not in the playoffs.
Yes, and he probably doesn't have I'm sure he's a great player, but he doesn't see pull as Mahomes, being out. So there's a lot of factors that go into this. He might have had a worse one too. Most of the time these players are getting MRIs. When we took care of the Giants and other football teams, it would be sort of MRI Monday. And so you come out and you get the MRIs on Monday after the game is played. And, there's different levels of high ankle sprains. And I'm assuming Edwards-Helaire was probably worse. So there's multiple factors at play here. But I think Edwards-Helaire's is more on the normal end, maybe a little slower.
Okay.
But the Mahomes is just extremely abnormal. I don't know how he's able to do it. I'm so impressed, but also a little bit worried. Is this going to be a long-term problem because he played through this?
So you think we'll eventually have some more information when this game is over? on his injury, and do you think, would it be typical, unless they already have that information, to then go in and maybe have another MRI after it's all said and done and to really kind of look at it? Or do you think the doctors already have that information and know, what the parameters are, whether he's going to need surgery or not?
There's a potential that they would get new imaging. The other thing is sometimes these can turn into bone, and that's a problem.
What does that mean?
And so they want to make sure that basically between the two bones, you can get something called a synostosis, where basically the two bones start to fuse together because he's played on it so much and it's sort of rubbed against each other. Eventually it turns into bone. It's not that common in an athlete, but it can happen, and that's a big problem. So they want to probably obviously avoid that. And so hopefully that situation doesn't happen as a result of playing through this. But I wouldn't be surprised if he had surgery after the season's over with, unless he's just really had such a minimal high ankle sprain that he's almost healed. But he wasn't, I think he looked pretty good, but he wasn't the same as he was a week or two before.
Yeah, he looked fine last week to start out, and then once he started running around and maybe somewhere early in the first quarter, he was already limping. So we'll see how that affects this game. I'm assuming that you're in agreement that having 2 weeks off helps this injury.
Yes,
and we'll see. I'm wondering if he's just doing kind of walkthroughs or anything like that. But that doesn't matter for the context of this show. Wide receiver Mecole Hardman. He had suffered an abdominal injury in November, and it kind of reminded me of this whole Lane Johnson stuff. He had an ab injury in November that caused him to miss over 2 months. He suffered a setback in practice when he came back from IR, and now the injury has shifted to a pelvis ailment. So what does that tell you when you had an ab injury, came back? He pretty much played very little in that last game, left the game, and now they're saying it's a pelvis ailment, and he's definitely out of the game. What happened there?
So, this is an area that's always a little bit hard to understand, I think, unless you sort of do general surgery. But what I imagine he probably had was he potentially had a sports hernia. So that means a little tear of his abdominal muscles. And usually that can be treated with no surgery, but occasionally, you've heard of people getting sports hernia surgery. Well, if you don't get it treated or it doesn't heal, sometimes you get a regular hernia. And so that may have been what he got.
Okay.
Again, all stipulation, but sometimes you can get these sports hernias that go on to bigger things. And so this is why they said sort of pelvis injury. Again, they're always doing everything in the articles to eliminate you from really understanding exactly what's going on. They don't want to let on exactly what level of injury it is, right? Whether they're going to come back. And again, it's for teams too. We've known coaches that have got in trouble for really sugarcoating or smoothing out the waters on the injury report, even though they're required to disclose that information.
Bill Belichick.
Yes, we know this well. So, but what's really exciting is I think in the future, in the next 6 months to a year, we're going to have a really good guest speaker on here, who's a surgeon who does sports hernias, to talk more about this, because really this torn adductor, abdominal injury, pelvis injury is a very sort of enigma for sports surgeons. And so we're going to have a great guest speaker on, and I'm really looking forward to that as our new sort of lineup for the Sports Doc Talk.
Love it. Jalen Hurts, they're saying he has a shoulder injury. He's had it for the last, maybe 5 or 6 weeks. He injured himself. No, longer than that, because he injured himself in the Chicago Bears game way back when. So he's had it and been dealing with it for a while. And even though he's running around, he's playing, he's not playing at the level that he was. I'm pretty sure he's going to be fine, just like Patrick Mahomes. They're going to compete. They'll be in the game. But when you have a shoulder injury and they're calling it a sprain, what does that mean? What are they telling us or not telling us by categorizing it as a sprain?
So, in general, most sprains of the shoulder are AC joint. Now, when I was looking kind of to understand this better, because it's really vague, there was some article mention of a sternoclavicular joint sprain, and that's a much more specialty level injury where you injure the joint. So you have your clavicle bone. Yep. On one side, the clavicle connects to the sternum. That's underneath where your heart is, right? That's an area you don't want to injure. And then the other side is the shoulder separation side. That's the acromial clavicular side. That's AC joint. And that's what most people get. So if you fall down the stairs or you have a friend that's fallen on their shoulder, it's usually an AC joint sprain. I want to assume this is probably an AC joint sprain because an SC joint sprain is just so uncommon and they would have probably talked about it more. So I think that was just a misprint of the article, which is another thing to discuss. You worry about it. You read 7 articles all from different sources and someone's got a different injury report. So that's always something for the audience to be aware of. If you don't understand, obviously you can go on our website, ask us questions. We're available. We can pop it up on a Sports Doc podcast at some point. But probably an AC joint sprain. And sorry to belabor the topic, but basically it's a shoulder separation and he probably a partial tear of the ligament. There's multiple different levels. A grade 3 or above or grade 4, 5, 6 are usually surgery. And the ones that are non-surgical, he probably has a grade 1 or grade 2. And so those can be treated sort of just rest briefly. Sometimes for the pro athletes, they do a cortisone injection to that area to try to calm it down. And they're probably trying to get this thing to sort of settle down. But it probably, I've had these, it hurts. And so I'm impressed he could play through it. But again, these athletes are a totally different animal. They have so many modalities to try to get them better. And they have, other treatments that we don't have access to. And they can just play through things. I mean, we saw what happens when Hurt goes down and doesn't not playing, they're a totally different team, just like Mahomes would be. Just like the San Francisco 49ers were.
No, no quarterback. That was that game was ugly. It was unwatchable. And for all sports fans out there, they say, well, why do you pay the quarterback so much money? Well, go back to that 49er game, and then you'll see why you need a quarterback to play football. All right, we're about to wrap it up, so I'm going to give you another trivia here. Okay, so Patrick Mahomes and Jalen Hurts it's the first time that we have 2 starting black quarterbacks in the Super Bowl. Can you name the first black quarterback to win a Super Bowl?
Did Warren Moon win a Super Bowl?
Warren Moon did not. He came close. He lost a game that he probably wants to forget as a Houston Oiler up in Buffalo. Bills, and Frank Reich came back and beat them after they had a big win. The reason I bring it up is because this team and this quarterback played in the NFC, or still do play in the NFC East.
I'm lost. You help me out.
It is Doug Williams. With the time they were called the Washington Redskins. And Doug Williams won a Super Bowl for Washington many moons ago. So that is our Super Bowl trivia there. What are you doing for the game?
I think we're going to hang out with some friends, which we're kind of trying to figure it out. Everyone always tries to find out that last week or so, what we're going to do. But looking forward to watching the game. And obviously my kids love the commercials. My little girls are not as into the football portion, but they know Super Bowl means friends, food, and commercials. So they're excited.
All right, give us your prediction in this game, Super Bowl 57.
I think I'm a Giants fan. I don't want the Eagles to win, but I think the Eagles are going to win. I think it's going to be at least a 7 to 10 point game. They look unstoppable right now, unfortunately.
Yeah, I unfortunately I do agree with you. I think if Kansas City can find a way to try to slow down that run game and that running attack, maybe they have a chance. And, I think that's what they need to do. And obviously Philadelphia has really good wide receivers on the outside, but I think you have to stop the run game or slow down the run game to give yourself a chance. But you can't let them run for 175, 200 yards between the quarterback and running backs and then expect to win. So if it's a close game, that's what I'm hoping for. It'll be really interesting, especially if Kansas City has the ball. I think Patrick Mahomes, he's got a little magic in him, but they have to keep the score close in order for that to happen, and control the clock. And that's what good teams, and that's what our Giants teams have done in the past when they've won. They've controlled the time of possession, so we'll see if that goes there. I'm going to give you one more trivia. It's a terrible trivia. I read it. I asked my wife about it, and she was like, this is dumb, right? Maybe because she didn't know it, or she thinks it's dumb. So here we go. Who manufactures the Lombardi Trophy?
Oh my gosh.
That's why she said this shit is dumb.
Probably somebody in Wisconsin.
No, it is the Tiffany Company. And I thought my wife, I was like, oh, Tiffany.
No way.
Tiffany. Yeah, Tiffany is the makers. They manufacture the Lombardi Trophy. So I asked her, she was like,
never have guessed that.
She was like, why didn't you ask me who the trophy was named after? I was like, because I didn't think you were going to get that one. She was like, yeah, I never would have guessed Tiffany. Why would I guess that? So that is my trivia question. That was terrible, and everyone
Great
agrees.
trivia.
Hey, let's wrap it up. It's great to do this. It is Sports Doc Talk, all sports, all orthopedics, all the time. Dr. Grant Garcia, our orthopedic surgeon and sports medicine specialist. Check him out, grantgarciamd.com. Lots of information there. Please go there, Dr. Garcia. I hope you have a wonderful time. I know you're going to get a little R&R, which is great for you and your family, and I hope you enjoy the game.
Thank you. You too, your family, and remember, follow us on Sports Doc Talk podcast on Instagram. We got YouTube and more coming. So visit us, check it out, request. So much fun to be had. We're looking forward to the future. And until next time, thank you, Will.
Take care of yourself. Bye.